السلام عليكم ورحمة الله وبركاته. Thank you very much, Dr. Ali. My name is New technique? Yes. Evidence-based? Yes. Assalamu alaikum wa rahmatullah. Good morning to everyone. My name is Haytham Al-Binjawi. I'm a consultant physician, internist, a medical educationist. I work as associate professor in the Department of Internal Medicine, University of Al-Baha. طيب, you will get a folder. In this folder, you get materials. One of these materials are materials that we're going to use in our activity, and the other materials are for you to use in your future. So Dr. Ali talked about the importance of evidence-based medicine, and he ended up with 5 important steps in evidence-based practice. What we will do in the coming 1 hour, inshallah, is going through these steps and try to be very practical in answering all these 5, or go through these 5 steps. The first step is you have, first of all, when you practice an evidence-based medicine, that you get a question from your practice. And the question in the practice is coming from 4 important domains. So possibly you'll have a question which is related to therapy of a patient, or you have a question which is related to diagnosis or etiology or prognosis. So these are the 4 important domains in the hospital when you practice. Questions regarding the practice coming from these 4 important domains. Okay, this is important, as we're going to see later on, because it will direct us to the source where I can get the evidence for this particular domains. Yes, next to Salah. طيب. We will introduce to you today what is called as Pequod or Pequod. One of the important things that you will be lost in the literature if you just have a question which is not clear in your mind. So first thing in practice evidence medicine is to sharp up your question, to be very focused in the question. And to be focused in the question, there are different methods of doing so. One of it is using what is called as Pequod format, Pequod. And we're going to practice this in a very short time. So Pequod stands for a useful tool which can help you clearly focusing the question. So when you go to the midline or go to the literature, you have a focus question. Okay. So once you have this focus question or 5 components of the Pequod being fulfilled, then you can easily go to the literature and find the evidence. Next. So what does Pequod stand for? P stands for the patient. So first of all, you need to be very clear about the patient or the population or the problem that you have. Second, I stand for the intervention. Intervention means what main intervention, prognostic factor, or exposure that you are considering. ST stands for the comparison or intervention, if appropriate. So what's the main alternative compared with the intervention in the previous I? Outcome, what can you accomplish, what you are accomplishing by asking this question. T stands for what type of question you are asking. As I said, there is a question related to diagnosis, question related to etiology, therapy, or prognosis or prevention. T stands, the last T, which is added recently, which is type of study, because there are different type of studies when you go to the literature. So let us practice this Pequod format. Let's go to the other slide, leave this one, go to the other one. So let us see how we can use our Pequod in focusing our question. So we are in the first step of evidence-based medicine, which is making a focus question. If you have a 35-year-old woman who has a family history of ovarian cancer, comes to the annual checkup, she is concerned about developing ovarian cancer and wonder if she should be tested for it. So you are practicing. I will give you an ophthalmology example just coming. You have a lady, she is 35 years old. she came to the clinic, she has a family history of cancer, and she's asking you, because she's having family history of cancer, if she's possibly going to get cancer in the future, and if this is possible, if there's any test to be done to be really, first of all, detecting this cancer early or no. So let's to the, okay, leave that one, go to this one. ارجع ليه خليها okay. طيب, I've taken that out because that's an obstetrical one, so go to the ophthalmology one. Endophthalmitis following eye surgery is one of the serious postoperative complications. There is an emerging resistance against topical fluoroquinolones. One of your colleagues told you that, okay, I've heard about honey, which work as an antimicrobial product, and if it's applied, it can work as a prophylaxis. Why don't you use this for your patient? So you are ophthalmologist, you know that there's resistance against medications which are currently available for you, and one of your colleagues confront you with honey as one of the antimicrobial problems. So let's do the PICO. So the P, as I said, stand for the patients. So those patients here in this scenario is a patient who's planned for surgery of cataract or vitrectomy. The intervention, which is new thing being confronted with, is the honey. And you want to compare the honey with the previous practice, which is the ofloxacin or quinolones. And the outcome you are looking for when comparing honey to ofloxacin is efficacy of this as a prophylaxis in eradicating bacterial ocular pathogens preoperatively. And if you go to the domain of this question, it's a therapy domain. So it's a therapy domain. So where is the question coming from? Okay. Type. So this is the way that the question coming in a patient scheduled for cataract surgery or vitrectomy. Is honey eye drops in compared to ofloxacin eye drops effective as prophylaxis against bacterial ocular pathogens? And this is a therapy domain question. And this, as I said, important when you go to the literature and search for this particular question. So what I want to say here is that you have a question coming, but by using the PICO, it became very clear to you exactly, it's become very sharp question. So P stands for patients, I stand for intervention, which is the honey in that particular problem. C stands for the comparison with the ofloxacin, and then outcome is stand for the effectiveness of this medication or honey as a prophylaxis against infection. So I want to give this small exercise for you. Next. Let us break this as a group. You are in the hospital, your patient is Jane, she's 76 years old female, she's hypertensive, and her hypertensive is being controlled successfully with beta blockers. But reading through the media, she heard about captopril, and she asks you if this would be a better medication for her. And this happens very much in the hospital nowadays, that patient coming asking questions for you. So if you want to break this to a PICO, P stands for population, I stand for intervention, C stands for comparison, and T stands for outcome, O stands for outcome. So what is the P here? If you want to say the P. P, patient. What's the patient? Any hypertensive patient? Any old patient? Okay, female. So when you come to put the PICO, you can say a female of 76 years old hypertensive patient. Okay? So possibly you get in the literature that male are different from females. Possibly get that antihypertensive is different in elderly patients. So be focused. A female of 76 years old who's hypertensive. This stands for the P, for example. What will it stand for the I? What intervention that we are looking for? Captopril. Okay? Yes.
So this is B. So what is next?
What's the I?
Is
Iscaptopril. Iscaptopril in compared to beta blockers. What's the outcome you are looking for? What's the outcome you are looking for? An effective controlling of hypertension. Okay? So in an elderly hypertensive lady, is ACE inhibitor or captopril in compare to beta blocker is an effective medication in controlling blood pressure of the patient.
What's the effect of a well-formulated people, for example, if we say in a hypertensive patient and in a 75 years old female hypertensive patient,
Mm.
in terms of the number of complications I get? Can you
Okay, before I answer Dr.
focusing?
Okay, before answering Dr. Salah's question, I just want to say that possibly Pequod will give you different scenarios. And as we know later on, when you come to the next part of evidence-based medicine, after you get a focus question, you go to the literature and ask the literature. It's important to know that for the Pequod, you need to make a different types of questions, as I'm going to show you in the next presentation. But what I just want to say, that the first step of evidence-based medicine, once you have a dilemma in your clinical practice, you want to take this dilemma to the literature, please use the Pequod to make things focused for yourself. Okay? Then, now you have a clear question in your hand, and the next step, you need to take this question to the midline. I just want to say that different midlines nowadays are recognized in the Pequod. So when you go to the midline, we get the areas for the Pequod which you can fill, and then this will give you the appropriate journal for yourself. So the first step is to get a question in your hand. The next step will be what? The next step in the 5 steps of evidence will be what exactly? As we said, the next step is searching.
We said first.
We said
Answerable questions. And the question should be
searching for the evidence. Type. Okay. Searching for the evidence require a competence and require a systematic way of doing so.